Naroon to the
Welcome everyone. School of Talent Economy actually working on this healthcare system, and especially we focused on uh, today. Actually, we focused on one of the specific areas, especially Australia healthcare system, because all of you are healthcare worker. So our objective that how we can train good healthcare worker according to the demand of the developed world. So today I'm gonna discuss on a very specific topic. Uh, on Australian healthcare system. Uh, because if you see the present conditions, like few of the countries, they are actually doing very well, like New Zealand, Australia, uh, they are actually performing very well in the COVID-19 situations. So, as our objective that we want to train some nurses for this pandemic situation, so that's why I try to give you some information. Already, we get some information about African healthcare system. Some of you actually share me uh, presentation. Uh, some of you actually share me different videos, some contents, some of the important like aspect of developing world, especially Rwanda. For me, Rwanda actually very new. I do not know much about Rwanda, but with the help of all of our students, already we know something. So before we proceed these IELTS things, just I want to give you some of the guidelines from Australian healthcare system. Our major objective, I share with you that we want to give you some flavor, some information that how actually developed world running their healthcare system. So this is some basic information about Australian healthcare system. Australian government and the key healthcare organization, they have Medicare, they have pharmaceuticals benefit schemes, they have Department of Veteran Affairs, private health system. So there are some of their geographical locations: Northern Territory, Queensland, South Australia, Western Australia, and New South Wales. So the time zones, definitely this is different. There are three different time zones. Australia Standard Times, Greenwich Times at 10 hours. Australian Central Time Zones applied at SA and NT, this is 30 minutes. And Australian Western Standard Times, AEST subtract 2 hours. Some very basic system. Now I want to discuss about healthcare system. Previously, you get information from European context, from American context. Today, we will discuss on Asia Pacific context. So, Australian healthcare system. The Australian healthcare system is complex and comprise a mix of public and private service provider supports by legislative, regulatory, and funding arrangements. Funding is provided by all level of government, health issuers, non-government organization, and individuals. The Australian government is responsible for the three national health subsidiary program: number one, Medicare's; number two, pharmaceuticals benefit schemes; and number three, the private health insurance rebate. The state and territory government are responsible for delivery of the public health service include public hospital, populations of health, public and community health service, and mental health. So beside that, like anyone from our student, Mr. Robert, uh, or Christine, or I think Mr. Robert, can you add some of your African context? Because already we know some information about Rwanda context, but I want to know in a broader aspect, like how does it work in South Africa? How does it work in Nigeria or other country in Africa? Mr. Robert, can you unmute, please?
Yes, sir.
Yes. So,
sir, can you please repeat?
Like, what is the healthcare system of Africa? How it works? What is the healthcare system? What is your experience?
Yeah. Anyway, what I can say on the healthcare system of Africa, Most of the healthcare system in Africa is governed by the government,
Okay.
by the ministries of health. Under the ministries of the health, there are other private institutions. Below the private institutions, there are other the government institutions like health centers. Below the health centers, there are other community health workers. So what I can say on the healthcare systems of the most countries of the Africa, as I said before, it is governed by the by the government. As I said, under the government, it's under the ministry. It is the Ministry of Health. Under the Ministry of Health, the referral hospitals, the district hospitals, and below those, the district and the referral hospitals, they are the health centers. That's what I can say on the structure of the African system.
Yes. One thing, like I want to know more about your vaccine situation. Like everyone get vaccine in Africa, or what is the healthcare situation right now?
Anyway, in Rwanda, the vaccination situation now is lagging on top, because we are about to 70% of the vaccination of COVID-19, and not even the COVID-19, but other vaccinations, like the children, the children vaccination. That's maybe what I can say.
Yes, I just want to share you some good news. You know, we have World Talent Economy Forum. So we work with many developed world corporations. So we get some sort of commitment from few corporations. Let's say they will work with World Talent Economy Forum, and whatever they make as a profit, they will utilize their money for vaccine in developing world. So this will be good news. I believe that when the corporation, they purchase vaccine for African countries, purchase vaccine for developing countries like even in Asia, and they will distribute it. But this is the way World Talent Economy Forum and School of Talent Economy, we try to get some good commitment. This is another things that we are getting commitment from the developed world, that they will create some job opportunity. But definitely I need more of your support, and I need some I know that you are doing hard work already. I get all of your assignment, some of your, actually not all of your. So I believe if you do hard work, then we can change your careers, we can help you to grow your careers, and definitely we will support as much as possible. So this, our initiative is very small, but we want to be very much effective. But you people need to support us, because if you do not do the hard work part, I cannot help you anyway. So just for comparison, and maybe you can relate, Australian healthcare system, the three level of government: Australian government, state government, federal government, Medicare Australia. For the Medicare Australia, there is a Medicare, PBS, and other program. So inside this Medicare and PBS, private patients hospital treatment and private practice. Under the state government, there is a public hospital and other program. So how many of you work in public hospitals, and how many of you work in private hospital? Is there any difference in Africa? Mr. Robert? Can you unmute? Yes.
Okay, sir.
Yes.
To me, I work in the state hospital.
Like in Africa, you have a hospital like 150 bed hospital, something like that. Or
yeah, true. We have.
okay.
We have for
I
like
know that Rwanda actually Singapore of Singapore of Africa. When we are in the sessions with Rwanda government and the collated lab, it's a Singapore of Africa. I know that you have good internet connections and some good facilities. Even you have a lot of challenges in 1994, but I know that all of you are doing good. So so that is the things. Anyway, the federal government funding provides Medicare's pharmaceuticals benefit scheme, aged care service, primary care service, private health insurance rebate, health service for a specific population group, defense force personnel through Department of Veterans Affairs, uh, and other committees. One thing, like example, in Rwanda, especially how your defense actually work, especially with the healthcare for this healthcare system. Can you share your idea, especially uh, uh, do you have any specific team from defense or any of the our nurses from defense or something like that, Mr. Robert?
Uh, what I can say,
Mhm.
uh, we also have the Department of Veterans, say,
Mhm.
uh, because we do have the schools of medicine as well, but in the veterinary affair.
Mhm.
So we have the school of medicine as well as the school of veterans, as you said before.
Okay. Thank you. So, so in Australia, actually support those who serve and have served in Australian Defence Force, provide a broad range of healthcare support service to the eligible veterans and their dependents through DVA and various health service provider, veteran home cares, public and private hospital care, respite care, community nursing. These are the things. Actually, we want to help even the African countries for develop healthcare policy. This is as a think tank. This is one of our important job, and definitely we love to learn more that how we can develop better policy, how we can develop a better strategy in the healthcare system. This is also one of the good planning from our side. So so there are some of the benefit actually their citizens actually get. They have gold card, repatriation gold card for all conditions. They have white card repatriation health cards. They have orange card repatriation health card, and especially Commonwealth senior health card. uh, and they have different strategy uh, to execute it. So let's say we as a team we are focused on Medicare system. So if we just identify Australian Medicare system, they have Australian Universal Health Insurance Scheme, a range of medical service, lower cost perception, and the free care as a public patients in a public hospital. How is Medicare funded? Australian taxpayer contribute through the taxation system. Medicare levy 2% of the taxable income. Medical levy surcharge taxpayer with a certain level of taxable income who do not have private health insurance may pay additional taxes. Medicare cards issued to all people eligible to access health services under Medicare's and used when visiting a doctor or using electronic claiming, submitting a claim from a Medicare office, making inquiries with Medicare, seeking treatment as a public patient in a public hospital, and filling prescription at a pharmacy. So I told you, like that is our objective. That uh, like we want to develop a better healthcare system, especially for the development world. So from the students, I just want to know like what is the health insurance system right now in Rwanda or in Africa. Anyone can share. Even Mr. Robert, you can share, I think, or Ramla or anyone.
Yes, sir.
Yes, I want to know your healthcare insurance policy.
Our insurance policy, I can say it has in Rwanda. Yeah, our
Okay.
healthcare insurance has two parts. There's the one that uh, is an organization, or we have an organization called the Rwanda Social Security Board.
Mhm.
Then it holds two parts. The one that is under the government workers, or the institution that has that has the ability to pay them
Mhm.
the big amount of and the one that is under the community insurance. The people that are not the government workers,
Mhm.
or another the non-governmental organization that has the ability to pay large amount of money. So in these two, the one that has 85% and the one that has 90%. The 90% is the community,
Mhm.
and 85% is for the government workers. It pays
Okay.
85%, and the worker pay 15%.
Mhm.
To the community pay 10% to access the service of the health, and the government pays 90% for that person to access the service, the medical care service. So that's what maybe that's what I can say in summary.
Thank you. Diani, can you hear me?
Yes, I can hear you.
Yes, actually, we are discussing about the healthcare system. We just do some strategic comparison in between Australia and Rwanda healthcare system because we are focusing on healthcare project. So, what do you think? Because you are from collated lab, even you are our partners in Africa. So, what do you think? How we can develop better policy for healthcare system in Africa?
Uh, Thank you so much, Mr. President. Uh, Noting the key point to support through this health system sectors, we need to correct the Drive Africa and World Economic Forum. For us, we can emphasize on technology. Which can help infrastructures which can help more the health system, particularly starting in my home country. In Rwanda, we need to emphasize on increase health system infrastructure, technology infrastructure, which is still barriers to access effective needs of patients. Also to increase health centers with the technology materials. Yeah.
Thank you.
Thank you.
We have our board of advisor, Muhammad Abdul Latif. Latif Bhai, can you hear me? Mr. Latif, can you hear me? Okay. Uh, okay. So that is some of the excess of Medicare service. Eligible patient can access free public hospital service and aftercare provided through the hospital. The hospital assign the treating doctors. Patient can opt to be admitted as a private patient in a public hospital. Can select their own doctors. Patients will be charged hospital and the medical fees by the public hospital. Medical insurance may cover this cost. So this is some of the model of Medicare benefit schemes and services in Australia. So pharmaceuticals benefit schemes, subsidiary schemes for prescription medicine. Eligible people can access certain prescription medicines at reduced cost. Approximately 80% of prescription dispenses are subsidiary through the PBS. Only drug listed on the pharmaceuticals benefit schemes. The schedule detailed clinic conditions and other criteria to be met for a patient to qualify for a PBS medicine, doctor must ensure the PBS medicine is prescribed in accordance with PBS requirement. So like example, when we discuss about healthcare system, we need to focus on number one, healthcare infrastructure, number two, enough human resources like doctors and nurses, number three, equipment, number four, pharmaceuticals, and number five, we are focusing on this pharmaceuticals industries. Latif bhai, can you hear me? Okay, I think he's with us anyway. So these are some of the very important strategy. These are some of the very important strategy they have. Then I just want to share some point, especially manual section of 1.3 for private healthcare system. Works in tandem with the Medicare to reduce the demand of public hospital service, include privately operated hospital and the healthcare centers which provide service to the fee-paying patients. Some private hospitals are contracted by the state government to provide a service to the public patients. Private hospital currently provide public patient service in WAR. So all countries have public and private issues. So
our patients also are there in claiming that they want electricity because it is not enough here in our country.
Okay. So do you want to share something about your electricity?
Yeah, I'm talking about here in Rwanda, our patients, sometimes they are claiming about electricity in saying that it is not enough. So they need, in the village, there is no electricity in whole village. So they want it, they claim to have it in whole villages. Thank you.
Okay, thank you. Latif bhai, can you hear me? Okay. So
with my phone.
Okay, Latif bhai, like he's even my mentor, a very nice person and world-class debaters. He's a champion debater from International Islamic University. Even now, he's a director for IIUM Oratory Club. Sir, Latif bhai, if you want to share some of your tips, especially how they can improve their English communication, you can. Okay, so I just want to focus on the policy of Australia and some of their very informative like strategic things, how they can attend in the session. Anyway, so the community based development. The community-based development, hospital in the home, provide hospital care in the patient's own home under the care of the hospital doctor, receive the same treatment that they should have received had they have been in the hospital bed. So they have silver chains and many interesting methods, and they have different kind of organizations. And most important thing is that this kind of strategy, why I'm sharing, this kind of strategy actually can help to make our life more safe. It can help us to grow our economy more effective. It can help us to move in an effective way. So cultural awareness. I know that Africa has different session. So I know they have different cultures. So I'm just sharing their culture, that Australian come from many cultural backgrounds. So medical staff should be mindful of the range of values and benefit that may be held by patients. Medical practitioners should be mindful of their own belief and values and be aware that these may potentially conflict with those of their patients. Be aware of potential sensitive areas such as termination of pregnancy, process of dying, and substance abuse. Code of conduct exists which guide medical practitioners to manage patient care appropriately. This may include referring the patient to a colleague. So this is some of the cultural awareness, especially most important part from my side, that we have to understand different culture. We have to understand different mindset. When you work as a healthcare worker in, let's say, in UK, so you have to understand the culture first. So for cultural, if you want to get the cultural benefit,
Yeah.
first thing first, you need to understand the language. So you must need to be very, very focused on your language developments. So I want to give you a task. Let's say if you give me a task, let's say the comparison in between Australian healthcare system and Rwanda healthcare system, or you can write good strategy of Rwanda and you can write some good strategy of Australia. So can you do that? And I get few of your email. So can you send me the email like tomorrow, Mr. Robert? Diani, can you hear me, Miss Diani? Ramla, can you hear me? Diani, can you hear me?
I can hear you.
Okay, so how we can develop a better policy for Australia, so for Rwanda? This is our next, like a case study we want to do. So, what is your advice for our students? And Latif Bhai, if you want to guide us, like how we can improve our English communication skills, you can
Okay.
guide us. Yes.
Okay,
Diani.
thank you so much, Mr. President. Yes, thank you so much. So, with our student, we can help. We can select key areas, key places, particularly in rural areas, where we need to increase to do our research, so that this research can help us to go through by designing which proper which proper technology infrastructure needed. For instance, in Western Province, we can check in the Rutsiro, we can check in Yamaseke, we can check in the Rusizi, or in Northern Province, we can check in Burera, also, or Gichumbi. We can check in some rural areas, also in the South and the Eastern. We can check exactly those particular rural areas and the health centers. We can talk to the patient. We can check even the health centers representative, even in Bugesera. Then we can see to each part which category of technology infrastructure are really needed so that we can improve effectively and faster in springtime about technology infrastructures. Because health system, yes, it's keep proceeding and progressing well in Rwanda, but we need also to improve well and faster by increasing technology infrastructures. Also, we need also to train local health supporters. In each village, we have health supporters, what we call in our mother's language, abajyanama b'ubuzima, so that they can improve, they can advance through capacity building about technology matters, so that it can help them by reporting or by communicating with the patient at the same time with the leaders, the fellow leaders. Thank you so much.
Thank you. Thank you. Latif Bhai, can you hear me? Okay. Latif Bhai, can you hear me? Okay, so thank you, Mr. Robert, Ramla, Devotee, uh, Diani, Christine, and Latif Bhai for joining today's session. So tomorrow we will discuss more things, and I request everyone you can subscribe School of Talent Economy YouTube channel. We have very interesting session today in World Talent Economy Forum. Diani, you can observe our show. Actually, we will discuss about sanitation problem. Uh, one of the famous entrepreneur from Singapore, Professor Jackson, he will join in our session, and some of the famous speaker from around the world they will join. It will help you. It will help you to understand different culture, different opportunity. So thank you, everyone. Thank you, Latif Bhai. Thank you for joining today's session, and Diani and
Thank you
everyone.
very much. Thank you very much.
Thank you. Can you hear me now?
Yes,
Thank
Latif
you
Bhai,
so much.
Thank
you
you.
want to share some tips with our student?
No. I'm just happy to meet you all. Of course, I was having some technical problem, so I put here halfway and then I got disconnected and I joined back. So I missed most of your discussion. Hopefully, next time I'll join again and enjoy listening to you all. Thank you so much. Thank you so much.
Yes.
Great opportunity to learn from you all.
Yes, Mr. Latif actually directors of IIUM Oratory Club, and he's a famous trainer as well. So he joined in our team. He will train you, and it will be very effective sessions. He is a very famous trainer. So I am sure that this kind of trainer actually help you to grow your communication skills, and especially you have. I know you have IELTS exam, so it will be helpful. So thank you everyone for joining today's session. Thank you. Bye bye and take care.
It has been a pleasure to meet you all.
Thank you very
Thank you.
Thank you so much, Latif. It's a privilege. Turabona bakurira ku